This is a podcast about the power of lived experiences, about how stories can shape more human-centered systems, spaces, and services.
Each episode, we sit down with people who are challenging the status quo, leading with empathy, and helping others through their work and their stories.
We're Farah and Megan, and this is Collected by Unum Co.
Welcome back to Collected. We are doing a solo episode today, just Farah and myself, Megan. We're happy to have you back and listening, and we're excited about today's episode.
Yeah, it's amazing. We've heard over the past 7 episodes, we've heard amazing stories from 7 incredible women who experienced barriers, struggles, came up against challenges in their own lives, and turned those experiences into innovation and impact.
Yeah, and with that, we thought we would take today to just reflect on some of the conversations that we've had and the stories we've heard, and talk about some of the themes that have emerged from these conversations. There's definitely been a lot of themes that have come out, and every conversation has been so impactful and eye-opening. But for the sake of time, we're just going to cover a few themes. And the themes, they relate to healthcare and how we can better improve healthcare, better improve the patient experience.
Absolutely. So, some of the themes that we really wanted to share with all of you today that we've seen across these conversations have been innovation that's come from barriers or challenges that these women have experienced, community as a form of medicine, which is something that we really learned through a couple of conversations and is something that's really close to us. And I think throughout all of them, this thread around stories as the tools for change.
And that's the thread for this podcast, is stories that drive change. And it's cool to reflect on the people that we've had so far, because our whole goal with this podcast is to collect stories of people who are making change, not just in healthcare, but across industries, and seeing how that change may impact or inspire healthcare as well. So now that we're stepping back and looking at these stories and seeing that the goal has come to life is really cool. Okay, so let's talk about the first theme, and that is when barriers force innovation. We've really seen this across a lot of the conversations that we've had, but the ones that have stood out were from Jennifer Patterson, who co-founded Coven Women's Health, Dr. Saskia Sivananthan, who's a leading data scientist and neuroscientist in Canada, and Maria Hogan, who's the founder of Fox Health. They've all seen this barrier within healthcare and have been able to create something bigger or better because of what the barrier was. So with Jen, it was that it can be really hard to access specialized women's healthcare in rural communities if you're not
Even in
living,
urban communities,
even
I'd
in urban
say.
communities.
Yeah.
It can be hard to access because if you can't get to a clinic, and then oftentimes even clinics, if it's specialized care, it can be quite expensive. So that's a barrier. And then Jen and Michelle, they created Coven Women's Health, which is a virtual women's health clinic. And they went virtual only because of that barrier. And then Maria Haugen, who's the founder of Fox Health, she built this app which gives women tools and confidence to advocate for themselves in the healthcare system. And she did this because she faced a barrier in her own healthcare journey in being dismissed about symptoms that she was facing. And it took her a really long time to get a diagnosis. And she wanted women to be able to not have to face what she faced and not have to go through that barrier. So now here's an app. And then when it comes to Dr. Saskia, she has been a huge advocate in the dementia space. I think the barrier for her really was that there's a large stigma involved when it comes to dementia and how care is perceived and done, but she's shifted how the system recognizes dementia in Canada, how it's seen as a disability, it's not a life sentence, and she has been really influential in changing how dementia is perceived in Canada.
Yeah, and I think beyond how it's perceived, I think she's advocating for dementia care to get not just more airtime and more awareness about what it means to care for somebody with dementia, but she's really championing change for the country in terms of what are the policies that are going to make dementia care more accessible? What are the types of systems and system changes that we need to put into place? Because I think that and she shared this quite openly with us. Canada has a dementia care strategy, a national strategy, but she's really trying to now focus on implementation and execution. So she's really championing that kind of system change at the grassroots level, which has been amazing to see. And I think throughout each of the three stories that you talked about, Megan, it was every one of those women had a personal lived experience that led them to want to make sure that others who came after them would experience what they did. And I think that kind of inspiration is so important because they used their experiences as that springboard for creating something that is going to have impact on such a large number of people across the spaces that they're designing in.
Yeah, and I think that as time goes by, we're going to see that these might not even be considered barriers anymore. Jen, Maria, and Dr. Saskia, they didn't really necessarily think like how do we help people overcome the barriers? They
Right.
started asking how do we remove the barriers entirely? And I
Mm-hmm.
think as time goes on, we're going to see that these barriers will no longer exist because there will be the tools and the services for people to easily access them,
And I
which is
think
really
they focused so much on what the problem was, and that made it feel so real. And I remember one of the entrepreneurs that I've loved for so long, and someone that I feel like I draw inspiration from, is Sarah Blakely. She's the inventor of Spanx. And she always talked about early on how, as a founder, it's so important to sell the problem, not the product. And I think in all three of these cases, each of these women really focused on the problem. And instead of trying to figure out, like you said, what do we need to do to eliminate these barriers in the current system, they just said, we actually are just going to go over here and build something else that addresses the problem that we were facing. So
Mhm.
I think that was something that really stuck with me.
And I think that from these conversations and this theme, as a takeaway for you as the listener, you can think about what are current barriers that you face daily or that you see in the industry that you're in, whether it be healthcare, business, any industry really. And how can you use those barriers as creative fuel to change something for the better? And how can you work around those? So I think that's something to really think about as you finish listening to those episodes and then finish this episode. So there are many barriers in healthcare. And one of those barriers is accessibility to good food in hospital settings. And with that, I think we can go to the next theme, which is community is medicine, because one of the stories we heard was from Kate Taylor Martin, who is the CEO and founder of Nut Bar, and she saw a barrier of not having accessible, healthy food in
Mm-hmm.
hospital settings and turned that barrier into creating a very healthy superfood cafe in Toronto, which she's been able to scale and grow over the years. And that kind of just kicks off the next theme.
Yeah, I think this idea of Kate started from the idea of food as medicine. And from that, Nut Bar evolved to a place where not just food has become medicine, but community has also. And I think that Kate designed her superfood cafes with such intention, not just around the types of ingredients and the types of food that she wanted to sell, but also a place that felt like you belong, a
Mm.
place that really invited people in and invited people to stay. And I think that also goes hand in hand with how do you nourish somebody? It's through the food they eat and also through how you make them feel. And I think that Kate really saw that and saw a need for that. And Nut Bar really is the embodiment of her vision.
Yeah, totally. And I've felt it in my own personal experience and journey with Crohn's disease, in that I could be trying different diets, different medication, a different way to reduce stress to help reduce my flare-ups and symptoms. But when I found community and was able to relate to other people going through the same thing, I felt like it was like a whole new treatment in a sense. And it really was medicine. It's something I preach. Talk about what you're going through, because you're going to find the people who are also going through the same thing, and it brings this community together. So whether it's a shared experience or a shared medical diagnosis or just a
Mm-hmm.
shared hobby, finding that community really is medicine for the soul. And as cheesy as it sounds, it's so healing.
And we also had a conversation with Robbie Spring, who talked about the very same thing. She was diagnosed with breast cancer as a young 20 something female and really felt like she didn't really understand the impacts of on her fertility, her career, her social community. And I think she also sought out others who were going through the same thing as her, people who got it. And
Mhm.
I think that's how she talks about it. And so she built that. She started down this, I think, unintentional path of advocacy, of self advocacy, because she was trying to deal with what was happening with her and believed that there were others who were experiencing similar challenges and barriers from a peer support perspective. And she shared that vulnerability. She shared her own lived experiences, and through that has built her own community, which I think is also filling gaps that clinical care is not and cannot address right now. And I think we've heard so many stories, especially coming out of a pandemic, around how social isolation is as bad for your health as smoking is. But I think we've seen now living proof of stories where people are actually designing community, whether that is virtually or in person, in order to support their own journeys.
So I think from all of these conversations, what does community as medicine mean for healthcare? And I think
Mm-hmm.
it can mean a number of things, but one of them being that peer support should be a standard practice. Imagine once you are diagnosed with, let's say, diabetes, you get the diagnosis, you're set up with your nurse practitioner, your endocrinologist, you go down the road of learning what your new normal is like living with diabetes. But what if you were also connected with like a buddy or a mentor,
Like
like
a
this
peer
peer support
mentor,
group?
or yeah.
That would be so cool. I think that a lot of people end up finding their peers, mentors, and communities after a diagnosis on their own. And it can be really challenging to do that alone. So if
Mm-hmm.
a healthcare provider was able to just connect you instantly, I feel like it'd be really interesting to see how that patient journey would change.
I think we always think about this as we build our own community, as we think about the importance of it, the importance of having spaces and places where people can connect and learn from each other and share what they're going through. And the many of these stories have the ability to shape and change systems and create new ones for that matter. And I think back to the conversations that we've had this year so far, or at least in this season of Collected, and the one that I think has stuck with me the most is Melissa Sheldrick's story and the advocacy that she has undertaken following the death of her son, Andrew, because of a medication safety error. Melissa has shared her story countless times. She turned what could have been such a traumatic experience to live through repeatedly. And she turned that into the most powerful form of advocacy where she has impacted and influenced change nationally in Canada from a medication safety policy and system perspective. And she's done that globally. And she continues to do that. I think she found her purpose after
Mhm.
this. It gave her new purpose. And she knew immediately that this is what she had to do to ensure that what happened to her son didn't happen to anyone else.
Melissa's story really is so incredible. I think every episode has a story and it's changing a system. We could go through
Mm-hmm.
all of them really and pull
Yeah.
out the story that they have and the change or the system that they're trying to change. But yeah, it's just, it's super, I think it's super important to own your story, no
Mm-hmm.
matter what the story is that you have. And if you feel comfortable enough to share it, then figuring out what space you can share it in and at what capacity you want to share it at, because you might not think that your story has any impact or any room to make change, but it most likely does.
Yeah, absolutely. And every conversation has been proof of that. And I think that one thing that I love about the people that we've talked to and the great lineup of people that we are going to talk to is just how much inspiration we can draw from these conversations and from the experiences of the people that we're talking to, which I think gives me so much hope about where positive change still can happen, especially from a healthcare perspective.
And that's what we're trying to do at Unum
Mm-hmm.
is to really use stories, whether they're patient stories, people with lived experiences, their stories to shift healthcare, whether that's patient stories in training, using narratives to train clinicians, or in clinical case studies, bringing patients to share their experiences directly. It's
Mm.
really getting patient stories out there so that they can drive change. And they can be applied in all sorts of settings like annual reports, website content, social media, marketing, anything that really amplifies the story.
And we hope that if you've listened to any of the conversations so far that we've shared through Collected, you realize that your experience matters, your voice matters, and whatever you're going through, whatever your experience is, find your community, find the people who are going through similar experiences, who have gone through similar experiences, and maybe that you can learn from, because I think that kind of experience is expertise. And the
Totally.
more we continue to name it that, the
Hmm.
more it can be used to drive change.
Hmm. And we have one call to action or a few call to actions for you. If you are a healthcare professional, what we want you to think, what accessibility barrier could you turn into an innovation challenge? Just think about that. If you are a patient, somebody with lived experience, or your patient advocate, remember that your voice matters. Keep using it. That's your call to action. Just keep using it. And then for everyone else, whatever the industry it is that you're in, just remember that the best ideas come from everywhere. And that's your call to action. And that if you have an idea, put it down on paper and start. Just start. It doesn't have to be big, it doesn't have to be perfect, but it's an idea and you can go with it. So thank
Yeah.
you for listening to this episode. We hope that you continue listening to the next episodes that we have. They are filled with great guests. We would love it if you liked our podcast, if you can subscribe, comment, share it. It will help us get collected out into the world.
And if you have ideas for a guest that you want to see, a future conversation that you want to have, or if you want to be a future guest, we'd love to hear from you. And thank you so much